Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Well, the holidays are over. Are you happy about that?
Thank goodness.
It's back to the routine, normal activities. And for a lot of us, we've set some goals for the new year, and getting fit and losing weight are often high on the list of people's New Year's resolutions. Now, whether your goal is weight loss or just feeling better and being healthier, adding activity to your day will help get you there.
Here's the million-dollar question. Yeah. How do you get started?
Well, we're going to find out.
Yeah, how do you stay motivated and avoid the common pitfalls? Here to offer tips to help you get moving is Mayo Clinic Healthy Living Program Wellness Specialist Tom Rieck. Welcome to the program, Tom. It's nice to meet you.
You too. Thank you so much for having me.
You know, the Healthy Dan Living Center is a pretty incredible place, isn't it?
It truly is.
Dan Abraham was a patient here and donated a significant portion of the money required to build this facility, right? And it's open to all Mayo employees.
Correct. So the first and the second floor of the actual Dan Abraham Healthy Living Center is for employees. Third floor is sports medicine. Fourth floor, all the way through 7, basically encompasses the healthy living program. And so we're actually open not only to Mayo Clinic employees, but we're actually open to everybody in the community. So whether you're a patient of Mayo, or a non-patient, a community member, or somebody that lives on the other side of the world, we'd love to have you in our program.
If you're someone who's newly retired from being a surgeon, you can hang out there more often than you do.
I might say, it sounds like you can eat there too. It's
right.
Pretty healthy stuff.
That's
though.
right.
A smoothie.
Getting people started, though, I think is the first time is always easy because you're all excited. You're going to start this new thing. But then maybe the second time is when the wheels fall off.
Correct. And I think what we do is we set ourselves up for a little bit of failure. So the new year rolls around, and we start with these big, huge, audacious goals that I want to lose 500 pounds in the next 2 weeks. And of course, that's not realistic. So I tell people we start very small, and we get that goal, or we try an experiment, and we learn from that, and then we rack it up a little bit for the next portion. So I even had one client that said, you know, she came to me, and this was relatively new in my personal training career, and she said, I have a 1 pound weight loss goal. And I said, 1 pound? I mean, you know who you're hiring here, right? And she said, well, I know because I've failed so many other times that if I start really small with this 1 pound goal, which seems ridiculous, but she knows it's something that's achievable. And then, you know, maybe it's the next couple weeks I can say, okay, now I'm going to go for 2 pounds and work my way up from there. So making sure that we don't have too big of a goal to start off with seems to help.
That's exactly what I was going to ask you. Give an example of a small goal. And you could always just say, I've got a 1 pound goal, and you just continue to have a 1 pound goal.
You got it. Yep. And I just keep adding, you know, next week it's another 1 pound goal.
Any other suggestions for small goals that people could consider?
Sure. So I always ask people, say, well, you know, how much time do you have to devote for exercise? And they say, well, I've got 90 minutes every single day. And I go, really? Do you live in that wonderful world that we all dream about? Of course not. And I say, well, what if we start with a third of that? Let's start with 30 minutes. And then I counsel them and say, well, if you can't make 30 minutes today, 29 minutes is still pretty good. And if 29 doesn't work, 28 is still pretty good there. And so maybe it only becomes, I can only make it for 5 minutes today. And just knowing that little bit of 5-minute movement is going to be beneficial much more than if you just said, skip it, I'm going to go sit on the couch instead.
When somebody first comes to you, someone new, do you ask them what their goals are? Do you help them formulate some goals, or how do you approach the first meeting?
Sure. So we do quite a big intake when people come through our program at the Healthy Living Center. We also work with wellness coaches. So that's a really nice person to have kind of in your corner. And their kind of approach to health and fitness is much different than most people's because they're not telling you what to do. So I come from I'm going to tell you what to do after we find out a little bit about you. And they say, well, what is your goal and how can I help you achieve that? And so we do a lot of different assessments to give people a good baseline. And I always counsel people, say, you know, take a look at the scale, take a look at some measurements and see where we're at, but then don't necessarily focus on those pieces, focus on the outcomes, focus on that journey to getting to whatever that goal may be. And then you'll find out it takes a lot of the pressure off from having to meet that, you know, scale goal on a daily basis.
What are some of the common pitfalls that people will encounter?
Oh, there's so many. You know, the big goal is number one, the kind of overextending themselves and then not celebrating those small little successes, I think, too. So, you know, my goal or my experiment today was to make it to the gym 5 times this week, but I only made it 4. Well,
that's impressive.
Yeah, but I didn't get, you know, I didn't make my goal. So now all of a sudden I've got this kind of negative self-talk and I'm missing out on the point in celebrating I made it to the gym 4 times this week, or I made it outside 4 times this week.
Is it a good idea if you're going to start an exercise or a wellness program, mainly exercise, that you see your physician first and say, I want to start this exercise in, is there any reason I shouldn't?
I would love for you to go see your physician, absolutely, because there's so much things that we don't know about that's going on inside of our body. I can't tell what my glucose is right now or if I have high blood pressure. So getting that little kind of check mark and that little stamp of approval from your physician, I think is very, very, very beneficial. And again, you can find some of those kind of baseline numbers so that when you come back in 6 months or another year, you can, again, celebrate those small successes saying, I went to the gym, I got my exercise session, or I got my movement session in, and look at what it's done to my blood pressure or my glucose or my blood values.
According to my show prep here, 80% of people will have quit their exercise goals by February. Do you agree with that?
Yeah, it's unfortunate. And we're trying to change that, right? We're trying to get that number down and down and more. And a couple different things we can do to help that is with everybody else together. So finding an exercise partner is always beneficial.
Mm-hmm. Well, you got one, don't you?
Yeah.
No, I'm looking at you because yes, producer Jen and I are lifting partners. We lift together, but we are about to become your accountability people because you're going to come with us.
Well, yeah, I'll be there in February because it won't be so busy.
That is true. All right. What are some other ways that we can flip that and be part of the 20% instead of the 80%?
Well, finding something you really enjoy. So a lot of people say, well, I have to go to the gym again today. And reframing that saying, well, not only do I get to go to the gym, I'm going to go do something enjoyable. So whether that's listening to an audiobook, plopping in front of Netflix, while you're on the treadmill, finding something that you enjoy and doing it consistently is more important than, getting on the treadmill and running for 5 miles. It's not for everybody, but finding something you really enjoy is, I think, the most important piece when you do choose to go do some exercise.
When you outline a program for somebody, do you base it on how long they have to exercise, or do you say, we got to at least start with 20 minutes, or how do you decide how long what's enough?
Yeah. So the current recommendation right now is about 150 minutes of movement throughout the week. And so, again, 149 minutes, you're probably doing okay. But, if you can only do 5 minutes a day or 10 minutes a day, that's still so much better than if you can't do any at all. And we know from research that people who are still struggling with the scale or obese and overweight, those people that exercise are actually much better off when it comes to their overall health and fitness than the people that are skinny and don't do any exercise. So every little bit does help.
And as people are planning what they're going to do to start off the new year, how much exercise should they be getting?
Well, we're shooting for that 150 minutes per week.
Okay.
That is kind of, what the CDC has said, that's going to, drastically reduce your risk for so many ailments and diseases.
If you've been someone who gets 0% of that 150 per week, maybe starting that high is not where you want to go.
Correct. So kind of slowly, increasing it over time is wonderful. So maybe it comes back down to, I'm going to exercise for 1 minute today. Mm-hmm. I'm going to jump on the treadmill for 1 minute. Probably when you're there, you're going to say, well, 1 minute was pretty easy. I can probably add a couple more. And that's my little sneaky way of, increasing your overall exercise.
I kind of like that.
Yeah. There was, for a long time, about a 10% rule is you don't want to increase your overall kind of activity level greater than about 10%. But research has really shown that we don't necessarily need to adhere to that as much.
How long have you been a personal trainer?
Oh man, I'm dating myself here. I think it's been about 10 years.
So what's the best tip that you have used to help people, something that you find that works for a lot of your customers, your clients?
I would say overall is finding what you like to do and then keep doing it. So we are lucky that we get to see people who are over 80, 90 years old, and you ask them, you're still here, number one, which is wonderful. But number two, what's your secret for success? And it's really is, well, I don't go out and run a marathon every single day, but I do go out and walk for 20 minutes or 30 minutes. And I do that most days of the week.
How often do you have someone come up to you and say, I can't thank you enough. I feel so much better and I've lost X amount of pounds. I bet that's fairly frequent, isn't it?
I'm very frequent, yes, and I want to toot my own horn, but yes, it is wonderful to hear those accolades that we get. And that's what really kind of propels us in the fitness industry to kind of keep going, is those kind of constant success stories that we do hear.
All right, well, keep up the good work, and we'll see you at the Dalk. We've been talking about ways to get moving and be healthier in the new year with Tom Rieck of the Mayo Clinic Healthy Living Program. Thanks for joining us, Tom.
Thank you so much.